Good morning to all. Today we have to discuss about the topic of hypersensitivity reactions. Hypersensitivity refers to excessive undesirable reactions produced by normal immune system. This reaction leads to damage, discomfort and sometimes fatal to the body. It is an appropriate response of repeated exposure to antigen. The immune response becomes injurious to the host. Hypersensitivity reactions develop in the course of either humoral or cell mediated immune response. Factors causing hypersensitivity. Factors causing hypersensitivity are allergens. In clinical terms, hypersensitivity is called allergy. Extrinsic factors and intrinsic factor drugs, penicillin, aspirin and sulfamide, airborne particles, pollen grains, spores, animal danders, foodstuffs, shellfish, vegetables, peanut, blood transfusion of mismatched blood, infectious organisms, bacteria, virus, fungi and parasites. Hypersensitivity reactions may be divided into two types: local reactions and systemic reaction. Local reactions when the symptoms appear in restricted areas. Systemic reaction means when symptoms affect all organ system of the body. Types of hypersensitivity. Hypersensitivity broadly classified into two types based on time taken for the reaction and based on different mechanism of pathogen. Based on time taken for the reaction is two types: immediate hypersensitivity and delayed hypersensitivity. Based on different mechanisms of pathogen is four types: type 1, type 2, type 3, type 4 and type 5. Based on time taken for the reaction, immediate hypersensitivity, when the immune reactions manifest in a short duration of time within minutes. Example, most of hypersensitivity drugs, penicillin, inflammatory response occurs in a few minutes. The immune reaction appears and disappears rapidly. It involves the interaction of antigen and antibodies. It is handled by beta cells by the production of antibodies. It is inhibited by antihistamine drugs. Next one is delayed hypersensitivity. When the immune reaction manifests slowly from 24 hours to 72 hours, it appears slowly and lasts longer. It produces erythema, indurations, and lymphocyte infiltration. They involves the reaction between antigens and T cells. Cell-mediated immunity. They are suppressed by corticosteroids. Based on the different mechanism of pathogen, Coombs and Gell proposed 5 types of hypersensitivity. Type 1 is anaphylactic hypersensitivity. Type 2 antibody dependent cytotoxic hypersensitivity. Type 3 immune complex mediated hypersensitivity. Cell mediated hypersensitivity. Type 4. Type 5 is stimulatory hypersensitivity. Type 1 immediate or atopic anaphylactic hypersensitivity. Type 1 hypersensitivity is an allergic reaction provided by re-exposure to specific antigen. Exposure may be due to ingestion, inhalation, infections or direct contact. The reaction is mediated by IgE antibodies and produced by the immediate release of histamine, tryptase, arachidinate and derivatives of basophils and mast cells. This causes an inflammatory response leading to an immediate within seconds to minutes reaction. The reaction may be either local or systemic. Symptoms vary from mild irritation to sudden death of anaphylactic shock. Treatment usually involves in epinephrine, antihistamines and corticosteroids. Mechanism of type 1 hypersensitivity. One person receives the allergens, it gets attached to beta cells. The allergens stimulate the beta cells to change into plasma cells. The plasma cells make IgE antibodies. These antibodies are called regens. The IgE antibodies produced for the first time get attached to the surface receptors of mast cell with the help of their Fc segments. As this initial contact with antigens lead to priming of beta cells, it is known as sensitizing or priming dose. Subsequent contacts with allergen causes manifestation of hypersensitivity, shock dose when the animal get exposed to the second antigen for the second time. The IgE antibodies attached to the surface of mast cells bind the antigen. The allergen cross-link the IgE antibodies attached to the mast cells. This triggers the mast cell where a series of enzymatic reaction occurs. This results in the mast cells to release the granules degranulation. These granules contain substances like histamine, serotonin, heparin, etc. These substances are primary causes anaphylactic hypersensitivity. The manifestation of anaphylaxis are due to the mediators. There are two types: primary mediators and secondary mediators. The primary mediators includes histamine, serotonin, and heparin. The secondary mediators are produced by leukocytes upon the stimulation of mast cells. These includes slow reacting substances of anaphylactics, SRSA, prostaglandin platelet activating factor, allergic asthma, allergic conjunctivitis, allergic rhinitis, anaphylaxis, angioedema, and urticaria. Type 2 antibody dependent cytotoxic hypersensitivity. In type 2 hypersensitivity, the antibodies produced by the immune response bind to antigen on the parent on cell surfaces. The antigen recognized in this way may either be intrinsic or extrinsic. IgG and IgM antibodies bind to these antigens to form complexes that activate the classical pathway of complement activation for eliminating cells presenting foreign antigens. As a result of mediators, acute inflammation are generated at the site and membrane attack complexes cause cell lysis and death. The reaction takes hours to a day. Type 3 hypersensitivity. Examples: immune complex glomerulonephritis, rheumatoid arthritis, serum sickness, subacute bacterial endocarditis, symptoms of malaria, systemic lupus erythematosus, others reaction. Type 4 hypersensitivity. It is caused by the interaction between antigens and sensitized T cells. Lead to inflammatory reaction, result in tissue damage. Antibodies are not involved here as T cells are involved cell-mediated hypersensitivity. Also, delayed hypersensitivity. T cells on contact with antigens produce soluble protein lymphokine. When T cells prime to an antigen come in contact with some antigen for the second time, the cell release lymphokines. This activates macrophages to kill intracellular bacteria. It involves tuberculin reaction. It is due to interaction of sensitized T cells and tuberculin bacterium. It is delayed hypersensitivity. Contact dermatitis. It is the inflammation of the skin due to contact with the substances to which the person is allergic. Some clinical examples: contact dermatitis, temporal arthritis, symptoms of leprosy, symptoms of tuberculosis, and transplant rejection. Type 5 hypersensitivity is caused by interaction of antibodies with the cell surface antigen leading to stimulation of cells. While comparing with the type 2, instead of stimulation, destruction of cell occurs. This phenomenon occurs in Graves' disease. Stimulation of thyroid cells by thyroid stimulating hormone is another example. Thank you.